Madam, we are live. You can go ahead.
Okay. So good evening, friends, and welcome to the second quarter final of today's Big Q. So Brain Teasers in association with OSN presents Big Q. And this is the signature tune of Brain Teasers. And this is of Big Q.
आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So I welcome our quiz masters who have toiled hard to create today's quiz and a wonderful experience of learning with fun. So I invite Dr. Shalini Mohan ma'am, Professor and Head, Department of Ophthalmology, GSVM Medical College, Kanpur. Dr. Akshay Nair, Director, Dr. Agrawal's Group of Eye Hospital, Mumbai. And Dr. Sumit Lahane, Director, Raghunath Netralya, Mumbai. So as we all know, such a mega project is not possible without a strong financial support from pharma company. So Microvision has been our steadfast partner since last 3 seasons. Our sincere most gratitude to Ashok sir, Mr. Kumaran and Mr. Navneet and all the field force of the Microvision for all their support. And this is a promo video from Microvision. We also thank Mr. Sai and Numerotech team for smooth and flawless execution of the quiz, computing results, and other back-end work which goes behind every episode. So before we start the quiz, let us quickly see what are the rules and the format of today's quarterfinal. So as we all know, there will be total 4 quarterfinals in which 80 teams will play, that is 20 teams per quarterfinal. And today is the second quarterfinal. Third quarterfinal will be on 10th of April at same time, that is 8 p.m. So for teams, you have to log in from 2 devices, one on the Kahoot and other for the Zoom platform. First screen is a Zoom platform for the live quizzing. Out of the 2 rounds, you will have to play 1 round on the Zoom platform that will be face-to-face and it will be only for the postgraduates in teams. Second screen is for the MCQ round, which will be played by both the audience and the teams, and it will be from the Kahoot platform. So 5 out of 20 teams from each quarterfinal will qualify for the semi-finals, but the criteria is your respective quarterfinal marks and total of the best of your 5 preliminary rounds. So format is MCQ, each set has 5 questions. There will be no negative marking. In the rapid fire, which will be face-to-face for the teams, 5 questions need to be answered in 30 seconds. If you don't know the answer, just say pass. You will get 30 seconds to answer 5 questions maximum. You will get plus 10 for correct response and minus 10 for the incorrect response. So better if you don't know the answer, say pass. So teams which did not qualify for the quarterfinal 2, they can individually play as an audience. And teams which did not qualify for today's quarterfinal, they can also play as an audience. So these are the prizes for the postgraduates in the finals. And these are the audience prizes per episode. So before starting the quiz, let us see whether our Kahoot is working properly or not. So this is the sample question for you. Which actor is expected to play role of Lord Rama in Nitesh Tiwari's upcoming movie Ramayana? Your options are A. Ranveer Singh, B. Ranbir Kapoor, C. Karthik Aryan, and D. Vicky Kaushal. Your time starts now.
What happened? One second.
Yes, time is up and let's see what is the correct answer. Answer is Ranbir Kapoor. So hope you all have tested your Kahoot platform. Now I welcome our first quiz master, Dr. Akshay Nair, who is director of Agrawal's Group of Eye Hospital, Mumbai. He is an ophthalmologist and a scientist. His area of expertise are oculoplastic surgery and ocular oncology. He is known globally for his pioneering work on mucormycosis. He has won various awards in national and international forums. He has authored over 130 indexed scientific papers and contributed 15 scientific textbooks. His major achievements are he features in top 2% of scientists according to the paper published by Stanford University 2022. He was the first non-American international member to be included in 2023 into AAO1 editorial board for a 5-year period. And he is also an elected member on the executive councils of the Oculoplastics Association of India and Asia Pacific Society of Ophthalmic Plastic and Reconstructive Surgery. So over to you, sir.
Thank you so much for that introduction. And I think we can go get straight into the quizzing. Right. So as the quiz master has very exhaustively discussed the rules, they remain the same. You guys are pros. You've done this multiple times. So all eyes on the question. We start with section 1 MCQ. I'll read out the questions with the options. The first is Upneek is a new FDA approved drug to treat ptosis. What is the molecule which is the active ingredient? And your choices are A. Phenylephrine, B. Xylometazoline, C. Oxymetazoline, or D. Papnivarzoline. And your time to choose the answer starts now. Right. So I hope you got the right answer. The molecule Upneek is actually oxymetazoline. It's called the red carpet drug to treat ptosis. You put in a drop in your eye, in the ptotic eye, and the eyelid can lift by up to 1.5 millimeters. But of course, it stays up there only for the duration of action, which is about 4 hours. So it's a temporary treatment, not a permanent treatment. All right, we go to the question number 2 on your screens right now. Orbital retinoblastoma has distinct subtypes: primary, secondary, microscopic, accidental, and overt orbital retinoblastoma. What is this classification known as? Your choices are: is it A, the Shields classification, or B, the Abrahamson's Wintersteiner classification, C, Abramson classification, or D, the Honavar classification? Your time starts now. I'm sure this was one that was simple enough for you to answer. Given the volume of orbital retinoblastoma seen in the Indian subcontinent, no surprise that it was Dr. Santosh Honavar, under whom I trained. I was lucky enough to train, who came up with a detailed classification on the pathophysiology and the way orbital retinoblastoma occurs and spreads. We go on to question number 3 on your screens. This is a figure with multiple numbers and lines that you see denoting different types of malformations. What name would you associate this image with? Your options are A. Collins, B. Tessier, C. Golden Hour, or D. Cruzon. Your time starts now. And time is up. This was slightly difficult. As you see, we are going into a little more difficult questions with each question. This is actually a picture that depicts the different clefts along which you get deformities like cleft lip, cleft palate, hair lip, even extending up to the nasolacrimal duct, the orbit. This was described by Tessier, and this is the Tessier clefts with numbers 1 to 14. Our next question is on your screens now. This is an image of an instrument. What is this instrument called? Is it A, lacrimal trephine? Is it B, a Jones tube guide? Is it C, a blunt tipped cannula for irrigation of the lacrimal system? Or D, a preloaded mini monoca? Your time starts now. And time is up. What you see there is actually a lacrimal trephine, also known as a Sisler's trephine, which is used to trephine through an obstruction in the canalicular system and then put in a tube or a stent. As you can expect, loads of oculoplastics and oncology from my end. Our last question of this round coming up on your screens. Of all of the following may occur in a patient with a palsy of the seventh cranial nerve, except A, epiphora, B, keratitis, C, ectropion, or D, ptosis. And your time starts now. And as you can guess, the seventh nerve is the facial nerve, which supplies the orbicularis muscle. So because of the loss of tone of orbicularis, you will have ectropion, which causes the puncta to go outside. So the patient will have epiphora, the eye will not close, and the patient will have exposure keratopathy. What the patient will not have is D, ptosis. So there we have it, round 1. Do we go to the scores or do we go to the next round?
No, sir. Scores will be at the
end. Fine. All right. Thank you so much for this opportunity.
Later on. So you have to invite ma'am.
Yes. So I have the honor of inviting Dr. Shalini Mohan, who's the professor and head of the Department of Ophthalmology at GSVM Medical College, Kanpur. And I know over the past few months with Dr. Prashant and Dr. Shilpi pushing us, we've had a great time collating all these questions. Ma'am has been a senior research associate at AIMS, where she did a senior residency, following which she worked at Sir Gangaram. She's at present the editor of the UP Journal of Ophthalmology, and her past secretarial and presidential associations include the Kanpur Ophthalmic Society, as well as organizing the UP State Conference in 2018. With 125 papers that have been cited 325 times, Dr. Shalini Mohan is an oft-invited speaker with over 400 presentations at different conferences. Her list of awards is extensive, topped by the Dr. B.C. Roy Gold Medal Award. And she's been the first amongst a first surgeon to do multiple things, including lamellar surgery in Kanpur, exenteration surgeries for mucormycosis, glaucoma valve surgery, and topical phacoemulsification. She's been a winner of multiple international travel grants to attend and present at international conferences. Our next round will be conducted by Dr. Shalini Mohan.
Thank you so much, Dr. Nair. And outset, I will thank Dr. Prashant and Dr. Shilpi for having me here in this very interesting quiz of postgraduate students. And so students, be ready for the next round.
Ma'am. So it is a rapid fire round.
Yeah.
So team one. Team one is the Eagles.
Okay, so team one, are you ready? So we will be going for the rapid fire round. Team
First,
one.
Team one, are you there? Eagles?
Not joined, madam.
Oh, okay. Team two, I Ninjas.
It's team 4 only, madam. 2, 3 have not joined. 1, 2, 3 have not joined.
Okay. Okay. So team four. Team four?
Yes, ma'am.
Please introduce yourself.
I'm Dr. Sumaya, final year DNP resident, and this is
Dr. Flawny, final year DNP resident from Aran Eye Hospital, Coimbatore. Our mentor is Dr. Abhishek sir, pediatric retina specialist.
Okay, all the best to both of you.
Thank you, ma'am.
So just again, I'm revising the rules. You will get 30 seconds to answer 5 questions. Okay. If you don't know the answer, just say pass. Be louder.
Okay.
So cryopreservation of donor cornea is done by which gas?
yeah, pass,
Which gas?
Pass.
Okay. Name the retinal dystrophy with synonym of fishnet with the knots.
pass,
Next. IOP is underestimated on applanation tonometer if the staining is
decreased,
decreased. Next. In Creutzfeldt-Jakob disease, what is the typical pattern seen in EEG?
Extinguished.
Anything else? More specific?
Flat ERG.
Any particular pattern? In early
Pass, ma'am.
disease. Okay, next.
Okay. So the time is up. You will answer. You can answer this, but you will not get the marks.
Okay. So you have to identify this particular person in the pic.
Pass.
Okay.
Let's see
So
that.
I will answer this for you. Yeah. So cryopreservation is done for the donor cornea by liquid nitrogen. It is almost minus 60 to minus 80 degree. And for cryopreservation is done for a year, right? So fishnet with knots, a typical reticular retinal dystrophy, where you see there are knots over there in the retina. And this is characteristic feature which is being described. That you were right that if staining with fluorescein is absent or insufficient, you get underestimation of intraocular pressure. In Creutzfeldt-Jakob disease, very typical pattern, which is triphasic waveform, and it is very periodic in nature. After a while, it comes again and again, which you find in early disease, and later on you see that this is extinguished response. And that person was the Frederick Best, who described the Best vitelliform dystrophy, and we know that it is a very, very popular dystrophy which we study, right?
Ma'am, what about fourth? Do we give marks or not?
Which one? Fourth? Okay, we can give marks for fourth.
Yeah. So they
Thank you,
attempted 4 questions. 2 were passed and 2 they answered correct. So plus 20.
Yeah.
So moving on to the next team.
Madam, team 3 has joined now.
Okay. So team 3, eye experts. Team 3.
Yes, ma'am.
Yes. So introduce yourself.
Ma'am, I am Dr. Sanskriti.
Ma'am, I'm Dr. Priyanka.
We are from PGIMS Rohtak, third year PG residents. Our team expert is Senior Professor R.S. Chauhan, sir.
Okay, all the best to both of you.
Thank you, ma'am.
Thank you, ma'am.
Yeah. So name the cause of such a defect in Humphrey's visual field.
Pass.
Next. Tacrolimus causes hyperglycemia. Is it true or false?
True.
Non-organic visual field constriction may be tested with dash into claimed blind visual field.
Pass.
The cause of myopia in Marfan syndrome.
Axial myopia.
Identify the German anatomist.
Pass.
Okay. Once you see this visual field defect, it is the advanced glaucomatous visual field defect where we find reversal of visual field in the pattern deviation plot, and that is why it looks as if it is normal, but it is not. So in very advanced glaucoma, you find such kind of visual field defect. Tacrolimus, you were right in saying that it causes hyperglycemia. So whenever we are giving it to a patient who is diabetic, we have to be very, very careful. Now, non-organic visual field constriction may be tested. If you test and find that there are saccades in the blind visual field, there you can test that there is some non-organic visual field constriction. The cause of myopia and Marfan syndrome is both a lenticular and axial. So we give half marks for this. The German anatomist, it's the William Brooks, Carl Ludwig Wilhelm Brooks, which is describe the Brooks membrane. And you know, it is a very important structure, right?
Thank you, ma'am.
Yeah, welcome. So do we have other teams also with us?
Yes. So class 15 to
Team 1 is
19.
also joined.
Very nice.
So team 1, the Eagles.
So is team 1 with us?
Team 1. Okay, ma'am. We move to another team, that is team 5.
Okay.
Team 2 is here. Team 2 is
What? 5 what?
team
Ma'am, we are team 2.
Okay. Team 2, I Ninjas.
Yes, madam.
Yes, please introduce.
Ma'am, I'm K. Saiteja. Ma'am, I'm Chandravadan. We are primary DNB first year from Arvind Eye Hospital, Coimbatore.
Okay. All the best to both of you.
Thank you. Thank you, ma'am.
So carbonic anhydrase inhibitors can be given in during 3rd trimester of pregnancy. Is it true or false?
False.
Center for lateral conjugate gaze in the brain is located in dash part of frontal lobe.
Pass. Contralateral.
Ipsilateral third nerve palsy with contralateral hemiparesis and tremors is seen in
Weber's syndrome.
ragged red fibers associated with ptosis and pigmentary retinopathy.
Pass.
Time is up.
Last
You
one,
can take the question.
time up, but last one we can show them. Identify the disease caused by this worm. Okay, can you identify this worm?
No, madam.
Okay, I think we can show them the answer. So that is true that it can be given during 3rd trimester of pregnancy, although there is no safe drug during pregnancy. Center for lateral conjugate is located in the posterior aspect of the frontal lobe. Whenever there is Weber's, you said, ipsilateral third nerve with contralateral hemiparesis is Weber's. But if there are tremors also involved, that means it is red nucleus involvement, and that is paralytic syndrome, right? So, ragged red fibers associated with ptosis and pigmentary retinopathy is Kearns-Sayre syndrome.
Kearns-Sayre syndrome है ये.
Yes, yes. And this is Onchocerca volvulus, which is responsible for river blindness. Right?
So, ma'am, they have given 2 wrong answers. So, it is -10 for them.
Okay.
So the next team is Team 1. Have you joined? Team Eagles? Okay. Now we'll take them last.
Okay.
So the next team is Team 5. Yoke muscles.
So can we have team 5?
Yes. Can you see us, ma'am?
Yeah,
Yes.
we can see you. Can you introduce?
Hi, this is Dr. Deepthi and I'm Dr. Nyantri. We're from Aravind Eye Hospital, Chennai. We're third year residents.
Okay.
And our
Best
mentor is
wishes.
Dr. Pooja ma'am, who's retina consultant.
Okay, best wishes to both of you.
Thank you.
Brimonidine can be safely given in the third trimester of pregnancy. Is it true or false?
False.
Next, in cerviginous choroiditis, the lesion typically begins where?
The periphery.
Third, talc by intravenous drug abusers can lead to.
Pass.
Next, painful Horner syndrome, ptosis and meiosis is seen in.
Cervical dissection, ICA dissection.
Next, treatment of choice in this particular case. Can you see this lesion?
Pass.
Okay.
Pass, ma'am.
So I think we can show them the answers. So brimonidine can be given safely in third trimester of pregnancy. That is false because it causes respiratory depression in the neonate and during pregnancy also. Serpiginous choroiditis, the lesion typically begins near the optic disc. Talc by intravenous drug abusers can lead to talc emboli and therefore subsequently lead to a blockage of central retinal artery and central retinal vein. Painful Horner syndrome, you said internal carotid artery. It is carotid artery and we will give you for marks for this. And this is what is this? Can you see this lesion? Can you identify?
So
which type of carcinoma is this?
it's basal cell. Oh, basal cell.
Yes, it is basal cell carcinoma. Can you see these margins? Just typical basal cell carcinoma and surgical excision is the treatment of choice. I thought it is a easy one.
So they get 15 plus 15. Okay?
Yeah.
Thank you. Thank you.
Okay.
So the next team is Team 6, that is Team Icons RNC.
Hello, madam.
Hello, good evening. Can you introduce
Good evening,
yourself?
madam.
Yeah.
Good evening, madam. I am Simran, and I have a friend, ma'am. We are from Medical College, Kakinada.
Okay.
And our mentor is Dr. Rama, madam.
All the best to both of you.
Can you see them because they are not visible?
Thank you, ma'am.
No, I can't see them. I can just
Where is
hear
your
them.
video?
Madam, I have kept the video on, madam.
No, it is not on. We can see only a logo which is coming.
No.
Simran. Make an art,
Yes, madam.
Simran.
Okay, let's start.
Okay. So azathioprine causes nephrotoxicity. True or false? You want to pass? Are you there? Simran, are you there? Simran? Team, are you there? I can't hear them at all. Is there
Hello,
a...
madam. Madam, we see the screen, madam. We can't see the screen, madam.
What? What happened? You did not answer? Are you...
Hello, madam.
Yeah. Can you hear me? Can you hear me? I think there is some network issue for them, isn't it? Dr. Shilpi?
Yes, ma'am.
I think there is some network issue for them.
Team 6.
Should we
Ma'am,
give them another chance, or is their chance over?
No, they can get the chance,
But I think they're not there.
it's okay. We'll move
She's
on
there,
to the
ma'am. She's there.
There? Are you
team.
there?
Next
She is
to
rejoined.
ఇంకా బిడ్డ నెట్ మెటబిలిటీ లేనా ఇంకా బ్లాక్ కెమెరా
Simran, you want to take the chance to answer other questions?
Ma'am, we'll call the next team.
Yeah, I think we should call the next team. And we will give them next set of questions, isn't it?
Yes, ma'am. Yes, ma'am.
Right.
So team 6.
So do we
Team
have
6.
team 6?
Team Macula. Team Macula.
Good evening, ma'am.
Yes, good evening.
Yeah, good evening. Can you introduce yourself?
I am Dr. Q Mondal, third year. IIMS Raipur.
Okay.
I'm Dr. Sharmila, a third year resident from AIMS Raipur.
Okay. All the best to both of you.
Requesting all the other teams, please mute yourself. So let's start.
Yeah. Cyclophosphamide leads to hemorrhagic cystitis. Is it true or false? Cyclophosphamide?
True.
Okay. Next. Which investigation is extremely important in idiopathic intracranial hypertension in children?
MRI.
Next. Arnold-Chiari syndrome presents with that kind of nystagmus.
Pass.
Next. Progressive drooping of eyelid as the day closes.
Myasthenia.
Right. Identify the image caused due to drug for the treatment of bladder disease.
Pass.
Okay. So we can show them the answers. So that is very true that it leads to hemorrhagic cystitis, cyclophosphamide. MRI, you were right, it is extremely important, but this should be combined with MRV also, especially in children. In Arnold-Chiari syndrome, we get downbeating nystagmus, which is very characteristic of the disease. Progressive drooping, you were right, myasthenia. And this particular photograph is produced by using of pentosan polysulfate maculopathy, which is used for the treatment of bladder disease. And you can see this is very classical picture due to this particular drug. So well done, team. Great. Congratulations.
Correct, ma'am. So plus 30 to them.
Right.
Next team is
Team 1 is joined, but
we'll take them later.
Okay. So now I would like to welcome Dr. Sumit Lahani, who is MS Ophthalmology from Sir JJ Group of Hospitals. He has also done his DNB Ophthalmology and FRCS from Narayana Nethralaya, Bangalore. Fellowship in Ocular Oncology and Oculoplasty from CSF Hyderabad. He is Assistant Professor at Sir JJ Group of Hospitals and Director at Raghunath Nethralaya, Mumbai. His interest is primarily in ocular surface disease, tomography, keratoconus, and postgraduate teaching. He has been in various posts in various society like secretary, managing committee member, ex-scientific committee member, and ex-organizing committee member in Oculoplasty Association of India. So we welcome Dr. Sumit to this particular quiz.
Thank you so much, ma'am. So I would like to thank Prashant sir and Shilpi ma'am for this platform to be quiz masters and interacting with so many postgraduates. And we will continue the round with the next team now.
So the next team is Team Element.
Hello.
Team
Hello.
Element.
Good evening, ma'am. Can you see us?
Yes.
Team Elements, you are ready?
Yes, sir.
Can see the screen?
Yes, sir.
There are 30 seconds. Just be quick. Okay. We'll start your questions.
Please introduce yourself before we start.
Yeah, please
I'm
introduce.
Ma'am, I'm Dr. Sneha.
I'm Dr. Anu. We are from Safdarjung and our mentor is Dr. H.S. Sethi, sir.
So here is the first question. Lattice dystrophy is also known as Biber, Hab, and
Pass.
Next, directional sensitivity of the retina leading to the stimulation of central then peripheral is called as Nernst phenomenon.
Pass.
Next, nystagmus of the spasm Newton syndrome disappears by true or false?
True.
Full form of RBF in Hill RBF. Next,
Pass.
this ophthalmologist evaluated one test to evaluate for the post-op hypotonic eyes. Test. Okay. Let's go to the answers. So it's Biber, Hab, and Demer dystrophy, which is also known as lattice dystrophy. The directional sensitivity of the retina is very famous Stiles-Crawford phenomenon. And yes, in spasm Newton syndrome, the nystagmus disappears by the age of 3. It doesn't persist. Hill-Bar RBF is an artificial intelligence-based, very famous formula, and RBF means radial basis function. And this gentleman is no one else but Dr. Erich Siddel from the Germany, who founded the test called as the Siddel test, which we use for hypotonic eyes. So I think they answer 1 correctly, nystagmus.
Yes.
So they get plus 10, correct?
Yes, sir.
Yeah.
Thank you, sir.
Which
So
is
the
a team?
Is Team Rangers.
I think the Eagles want to talk something.
So can you see us?
Yeah, Rangers, correct?
Yes, sir.
Can you please introduce yourself?
Sir, I'm Dr. Rahul. Can you see us, sir?
Yeah,
Yes,
we
yes,
can.
yes.
Yeah.
I'm Dr. Rahul and my friend is Dr. Jamil. We are final year residents from Sarojini Devi Eye Hospital, Hyderabad, Usmania Medical College.
Okay. Fine. So there are a rapid fire round for you.
Yes, sir.
Don't know anything, just go ahead with the pass. So you might get the time again to solve that question. So let's start your round. Questions, please. Which is most aggressive form of OSSL?
Pass.
Next. Tritanopia is due to defect in chromosome number, blue color defect.
7.
Next.
X chromosome.
Okay.
Longest finish.
Longest and there. It insert
True.
upper and upper.
True.
Next. Is dash.
Pass.
Next. Pseudo-treated dash anti-glaucoma medication. Just say the group of the medication. Okay.
Carbonic anhydrous.
Okay. Answers, please. Yeah. So mucoepidermoid is the most aggressive one, and blue color defect is by 7 chromosome. X is what is most common. Superior oblique muscle is inserted superior to the equator, not anterior. You said true. Argos is again a new source based optical biometer, and pseudodendrites is by latanoprost and not carbonic anhydrous. Carbonic anhydrous will have a your dendritic pattern or your viral reactivation. It may not cause pseudodendrites always. So let's see. They gave 1 wrong answer, ma'am. They said 2 wrong answers. Correct.
So 0.
Yeah.
Yes. So the next team is Team Dhanvantri. Team Dhanvantri.
You can see us?
Yes.
Yeah. Can you please introduce yourself, Team Dhanvantri?
Yeah, I'm Dr. Shriyanka. I'm Dr. Shivani, and we are from JSS Hospital, Mysore, and our mentor is Dr. Bindu Malini.
Okay, great. So you are ready, Team Dhanvantri, for your rapid fire?
Yes, sir.
Let's shoot. Next slide, please. Inheritance pattern of juvenile glaucoma is?
Pass.
MP delta sign on
Pass.
Next, direct atrophy, X-linked recessive associated with hyperornithemia.
True.
Next, which chromosome is affected in the clear vision due to oxygen deficiency?
Pass.
Next, silver deposition in cornea is called as?
Pass.
Okay, fine. Juvenile glaucoma is autosomal dominant. Empty delta sign is very classical sign that we see in the SVT patient presenting with the head. Gyrate atrophy, hyperornithemia is correct, but it's recessive disease, not recessive. So this was wrong. Which chromosome affected in the rhodopsin? Rhodopsin is again classical 3, not X chromosome. And silver deposition in the cornea is a rare condition also known as argyrosis. So they gave one wrong, no correct, so -5. Correct, ma'am?
Yes.
Okay.
So next,
Well, Team Manvantari. Next is
Team Eagles.
Team Eagle.
Hello?
Yeah.
Hello?
Yeah. Can you
Hello,
hear?
sir. Can you hear us?
We can hear you. Can you introduce yourself?
Yes, sir. Sir, myself, Dr. Megha Goyal, and
I'm Dr. Priyanka Saini.
we both are third year residents from PGIMS Rohtak.
Okay. Can you see
And
the?
sir, our mentor is Dr. Nibha Pasi.
Okay, great. Can you see the screen?
Yes, sir.
Okay. So let's start your round now.
Yes.
The question: amplitude of the nystagmus is largest in the far field. This is by Newton's law.
Alexander Law.
Next, reversal of the dark light pattern on the specular microscopy is appearance of dash cells. Next,
I cell.
which is in the diameter of convex lens, there is increase in the field of view and magnification.
Fall.
Next, diabetic optic atrophy is most common inherited form of autosomal dominant dystrophy.
Lebers.
Can you spell it?
Sir, Leber. First of yes.
Next question will just show you need not answer. This was a histopathology of granular dystrophy. Let's go to the answers. So you are correct. It is Alexander law for the amplitude of the nystagmus. Ice cells is a very classical reverse dark pattern. Increase in the diopter power will, of course, field of view will increase, but magnification will decrease because it is 60 diopter divided by your this. So that was true, but you said false. And most common autosomal dominant optic atrophy is Cager's optic atrophy, basically by Dr. Paul Cager, Danish ophthalmologist, and this was a granular dystrophy stained with the Masson trichome. So you give 2 correct and 1 wrong. So that is plus 15. Correct, ma'am?
Yes.
Shilpi, ma'am?
Hello.
Yeah, labors also they gave 2 wrong, I suppose.
2 correct, 2 wrong. So plus 10.
Plus 10, yeah, correct. Plus 10. Well played, Team Eagles.
So now it's time again for the commercial break.
She kept kada.
So we'll start with the section 2 of MCQs by Shalini ma'am.
Again, I don't know. Some knowledge points.
Team Shimran Bhattacharya, please mute yourself. Shalini ma'am. Shalini ma'am.
Yes.
So ma'am, let's start with the second round of the MCQ.
Okay, fine. So view the image and strike the correct option. So see it very nicely and clearly. So our first is square grating are useful in producing two diffraction orders. Second option is glazed grating produce third order diffraction rays. Next, chirp gratings produce two diffraction orders focusing towards the center. And last is blazed gratings produce two diffraction order focusing towards the center. So first you have to identify the grating and then accordingly you have to answer the question. So the answer is chirp gratings produce two diffraction order focusing towards the center. So in blazed grating, what happens is that the thickness of these gratings, they don't get reduced as we move towards the center. But in chirp grating, you can see these thickness reduces. And that is why the two order refraction, these are first order and this is the second order refraction. And the second order gratings, they tend to become focused towards the center. And that is why these are known as chirp gratings. So answer is C. Can we have the next question? Right. So this is a 22-year-old female who presented with this finding in her eye. Identify the most probable cause. Your options are shallow anterior chamber depth. Next option is shallow posterior chamber depth. Third option is small sizing. And last option is large sizing. Your time starts now. And the correct option is small sizing. So you can clearly see there is this ICL and low vault of ICL is due to small sizing. So here you can see the small vault is there and that is why the sizing is not correct in this particular female. So C is the correct answer. Now, this is a 60-year-old male patient who underwent glaucoma valve surgery for his uncontrolled secondary glaucoma following post-vitreoretinal surgery. His IOP started rising and vision started deteriorating after 2 weeks of surgery. Now, see the picture here and decide the common reason for such a problem. And your options are blockage of this tube by the blockage of the tube of the valve. Second option is hypertensive phase of glaucoma valve. Option third is choroidal hemorrhage. And option fourth is retinal detachment. Your time starts now. So the correct option is choroidal hemorrhage.
At the back.
So here you can see that the tube has been inserted into the posterior chamber of the eye. So whenever we insert the tube in the posterior chamber, there are chances of choroidal hemorrhage, which can again lead to rise in intraocular pressure. And here we can see the tube is not blocked by any of the tissues. In hypertensive phase, you will get a large bleb over here in the superior part where the valve has been implanted. And in retinal detachment, you get hypotony. So the answer is C. Next question. This 35-year-old woman presented with a 1-week history of painful right eye and decreased vision. She was found to have left circumciliary congestion with cells and flare. The fundal appearance showed following findings. Which test will you order to confirm the diagnosis? Your options are C-reactive protein, serum ACE, HSV titers, and CD4 counts. Your time starts now. So the answer is answer B, because these are the typical findings of a patient with sarcoidosis, where you find this kind of typical fundus picture along with iridocyclitis, where you find left circumciliary congestion with cells and flare. So the answer is serum ACE. You have to get it done in this particular patient. Now, you need to identify the ophthalmic abnormality associated with this hematological finding. And you have to find out which are all except. A is night blindness. B is saccadic movements. C is proptosis. And fifth is internuclear ophthalmoplegia. And your time starts now. And the correct option is proptosis, because here you see these kind of acanthocytosis, which is spiky red blood cells, and they are classically seen in A beta lipoproteinemia. And these are associated with poor night vision and pigmentary retinopathy. And they also show slow saccadic movement with internuclear ophthalmoplegia and external ophthalmoplegia. Ptosis, which typically occurs in abducting eyes, classical feature of this particular disease.
So now we move on to the rapid fire round again.
So the next
So
team.
the next team rubiosis. Team 11.
Rubiosis here.
Yes, sir.
Can you please introduce yourself?
I'm Dr. Pranoti. I'm Dr. Devika. We are from Shankara Eye Hospital, Coimbatore, sir. And our mentor is Dr. Priyadarshi.
Okay. So can you see the screen? You're ready for the questions?
Yes, sir.
Let's roll then. Questions, please. Most common pattern of color confusion in the acquired color defect is acquired.
Pass.
Next. During the gross examination, which extraocular muscle is landmark for the laterality of the globe?
Hirschberg.
No. Next. After the ZAP study, doing PI will reduce the incidence of primary angle. True or false?
True.
Which trial after comparison reached to the conclusion that no additional benefit to using grid laser or the ranibizumab alone?
Pass.
I'll show you the fifth question, but the time is up. There's a brown pigmentation shown on conjunctiva, which used to happen because of some old anti-glaucoma drug. We'll go to the answers now. So acquired color vision defect most commonly will have a confusion between blue and yellow. The most important landmark is inferior oblique muscle. That's how the pathologist can tell you it's a right eye or the left eye if you forget to mention. You're correct about ZAP study. It reduces the angle closure glaucoma, but the development of angle closure glaucoma even without PI is 1 in 20. So the whole study purpose tells you that there is no need of doing a prophylactic PI in every patient of occludable angles. Or which trial after comparison is a brighter trial, and the blackish pigmentation is nothing but an adenochrome deposit which happens due to the epinephrine. So they answered one correct. Shilpi ma'am?
Yes, and one wrong, sir. So it is +5.
Okay.
Thank you, ma'am.
Well played. And now the next team is going to be Oculo Minds, team number 12. Can we have team number 12?
Hello, sir.
Yeah, please introduce yourself.
Sir, I'm Dr. Roshni. I'm Dr. Shruti. We are from AJ Shetty Medical College, Mangalore, and our mentor is Dr. Rajni.
Great.
Okay.
So
So over to you, Dr.
Yes, sir. Yes, sir. You can see the screen. Are you ready for the
Yes, sir.
question? Okay.
Yes, sir.
Questions, please. Which test can be used to assess retinal toxicity in phototoxic biology?
Pass.
Next, most characteristic histological finding of pterygium within the definition of pterygium.
Fibrovascular mass.
Next, when dystrophy patients have a Artin ratio less than 1.5 when tested with EOG.
False.
Next, dissection superficial to the periosteum or the zygoma of the bone can cause injury to dash dash nerve.
Trigeminal.
Okay, last question I will show you.
Last question.
The answer. This type of a teeth configuration along with the keratitis is caused by dash. Yeah. So we'll go to the answers. See, any retinal
What
toxicity.
about
Yeah.
second one? Shall we?
Sorry, ma'am.
What about the second answer? Shall we give them marks or what?
No, ma'am. She said fibrovascular. Either the term either basophilic or elastotic. One of them was expected in the answer. So we cannot give for the fibrovascular thing. And the third is true. EOG is a very diagnostic test for the Best dystrophy. And you said this is false. Zygoma, generally it's a facial nerve, seventh nerve damage that will happen and not the fifth nerve. And last was Hutchinson teeth, and it was about interstitial keratitis caused by Treponema pallidum syphilitic. So you gave two wrong.
Three
Yeah,
wrong.
three wrong.
Third and fourth. Yeah.
So the cumulative score for them
Minus
is
15.
minus 15. Okay, fine. So, okay, don't get disheartened. We are a long way to go ahead. Best of luck for the next rounds. So let me invite the next team that is going to be Vision 2020. That is team from Patna, PMCH. Vision 2020.
Are you here, Vision 2020?
Are we visible?
Yeah, we can see you now.
Be closer to the mic, please.
Come closer to the mic so that the quiz master can hear your answers properly. Otherwise, he might miss out and you might get a wrong answer. Negative marks. Okay, fine. So please do introduce yourself from PMCH team.
I'm Dr. Shweta. I'm Dr. Nadia. Our mentor is Dr. Sanjeev Kumar, and we are the residents from PMC Patna.
Which year residents?
Second year. Second year.
Second year. So, well, ready for the show?
Yes, sir.
Over to you, Sumit.
Yes, sir. So your questions are here. Chronic mucous discharge in anophthalmic catheter due to diabetes conjunctivitis. Some kind of allergic conjunctivitis. Next, image seen with the indirect ophthalmoscope is. We need to know if it's real.
What? Real and inverted. Real and inverted.
Real inverted. Okay. This is a type of MRI. T2 which image shows it's bright, allowing the plaque to be seen better. True or false?
True.
Okay, I'll show you the fourth and fifth question, but you can't answer. The inheritance pattern of atropia areata. And next is the legendary person. Can you guess who is he? He is someone who devised a viscoless SICS surgery.
No, sir.
Okay, we'll go to answers now. The first is a papillary conjunctivitis. Allergic conjunctivitis is always papillary. Image you said real and inverted, correct? Flare basically is a type of a MRI which is not like a T2. It will suppress the fat. So T2 will show the CSF bright, but flare with the T2 will show the CSF dark. So this is false and not true. So this is wrong. So you are 10 and then minus 5. So it's total 5 marks. Inheritance pattern of atropia areata is autosomal dominant, and this famous legendary surgeon is none other than Dr. Michael Blumenthal from Israel, who invented the Blumenthal technique of SICS.
And Sumit, he also passed away because of metastatic choroidal melanoma. So another ocular oncology related trivia.
So the next rapid fire round will be by Dr. Akshay Nair, sir.
So Akshay, welcome.
Welcome, Are sir. We've been there. Welcome to you. Good to
Thank you,
see you,
thank you.
sir.
I know I missed initial rounds of you, but yes, I was stuck up in the theater. So over to your Akshay.
Team 14 is GMC Bhopal.
Yeah, let me invite the team from GMC Bhopal. Team 14,
Hello, sir. Can you see us?
get your video on. Yeah, please introduce yourself, your mentor, the college, and
Yes,
then
sir.
be ready for a grill from Dr. Akshay.
I'm Dr. Shiva Srivastava. I'm Dr. Alpana Badolia, and our mentor is Dr. Aditi Dubey ma'am. We are from GMC Bhopal.
Which year residents? Final or the
Second year resident.
second year residents? Well, ready for the show?
Yes, sir.
Your quiz master, luckily, unluckily, I don't know, is going to grill you now. I know this guy.
So for the next 5 teams, I'm giving you a pleasant bit of information. Compared to the previous rapid fire, my rapid fires are much more easier. So
So now the quiz masters are now having a tug of war. Who is going to be more better for the quiz? We will have a vote at the end of the conclusion of our quiz for sure.
And there is one disclaimer that all the questions said by the quiz master may not be made by them, may be given to them by someone else as well.
my questions are all made by.
Okay, come on, let's get it.
All right. So your set of questions begins now. Rapid fire 14. Intravitreal injections of drugs are used in the treatment of retinoblastoma. True or false?
False.
Is incorrect. Expand the acronym SMILE. You can pass if you're unsure. Dysport, Xeomin, Myoblock are different marketed names for what molecule? Who is credited with the invention of the binocular indirect ophthalmoscope?
Yes.
And we can share the last question without getting an answer. I mean, if you can answer, it won't get you points. Dacryology deals with what part of the eye?
Lacrimal apparatus.
Lacrimal apparatus. Unfortunately, that was the only one that you got right. Intravitreal injections are actually used in the treatment of retinoblastoma. Intravitreal melphalan, topotecan are given. SMILE is small incision lenticle extraction, a form of refractive surgery. Dysport, Xeomin, and Myoblock are molecules of botulinum toxin. Charles Siepens, the father of retinal detachment surgery, is credited with the invention of the binocular indirect ophthalmoscope. And you got the dacryology question. Unfortunately, that was after your time had elapsed. So we go to team 15.
So that's going to be team BMC Sagar from Bundelkhand Medical College, Sagar, Madhya Pradesh. Welcome, team. You're muted, I believe.
Thank you, sir. Thank you, sir.
Introduce
Myself, Dr. Nitin Kushwaha. Sir, myself, Dr. Adesh Mulla, first year resident, BMC Sagar. Or mentor is Dr. Parveen Khare, sir.
I'm really, I should really congratulate. They are first year resident. So Dr. Akshay, you have to be a bit lenient to these guys. You should salute their valiant effort to be competing with the final and the second year residents.
Absolutely agree. First year, to come to this level as first year residents is amazing.
Yeah,
Sir,
great.
I am third year resident. He's first year resident.
Okay.
Okay, fine.
So that's okay. That's okay. That's good to see residents working together.
Thank you, sir.
All right. So your rapid fire starts now. EDOF lenses work on the principle of a single elongated focal point rather than several foci. True or false? Is correct. Expand GHTC.
Pass.
Which is the FDA approved human monoclonal antibody for thyroid eye disease?
What?
A numerical value of the vessels which pass over the optic discs to assess optic atrophy is known by what name?
125.
Is incorrect. And the last question, which you may want to answer without points, is what is the most common presenting sign of ocular myasthenia gravis? Ptosis is correct. the second team in consecution to get the right answer, but after the time has elapsed. We got your first question, which is EDOF lenses work on the principle of a single elongated focal point, correct? But we got the Kestenbaum index wrong. I heard a numerical value of 0.25, which is incorrect. So one right and one wrong.
So +5.
So
Plus 5 to you.
Yeah, great.
So the next team is team 16.
Warriors.
Team
That's
16.
NRI Institute of Medical Sciences from Visakhapatnam.
Are we audible, sir?
We
You
can
are.
hear you, but we can't we can't see you.
Sir, I've turned on my video, sir.
Okay, okay, fine.
All right.
Thanks, sir.
Teams, remember, if you do not know the answer, in 30 seconds, you have the option of passing and coming back if you have time.
Yes, sir.
Right. So we start your round of questions now.
Yes, sir.
Eylea or aflibercept is a monoclonal antibody approved for the treatment of rare is incorrect. Expand D or
Keratoplasty.
is correct. Reticert and UT have which molecule in them?
True. What is the steroids, sir? Fluocinolone acetonide.
Is correct. What is the name given to iris lesions in
List nodules.
neurofibromatosis?
List nodules.
Is correct. The use of
Steroid
absolute
alcohol. Steroid
alcohol.
reduced chance.
The reduced use of absolute. I've started, so I'll complete. The use of absolute alcohol in an evisceration
Chance of what?
is to theoretically reduce the chances of what
Pass, sir.
condition?
Pass, sir.
Pass. All right. Good. So you go to the answers. Eylea or aflibercept is not a monoclonal antibody.
Okay.
You got DSEC right, fluocinolone acetonide right, and Lish nodules right. So 3 right and 1 wrong gives you a total of 25, and smart enough to say pass to a question you didn't know.
Thank you.
So well played. In fact, they are amongst the
25.
They are amongst the top scorers in this rapid fire round. So plus
That's
25.
right.
The highest score has been plus 30 till date. Great.
Next team is team 17, KEM.
Ravenclaw. That's from KEM.
Good evening,
Mumbai?
sir. Yes, sir.
Good evening.
Harry Potter fans?
Yes, sir.
Where is your teammate?
Yes, sir. Ma'am, I'm here. She is in district residency, so we are not together right now.
Yes, sir.
Okay, fine,
You
fine.
both have logged in?
Yes, ma'am.
Yes,
So
we
who
have
is
logged
going
in,
to
but
answer
she's
finally?
typing in the answers.
Exactly.
Okay.
No,
I'll
we
be-
won't be able to type answers. The first answer I hear will be considered as the answer that we'll consider right or wrong.
Okay, sir.
All right.
Okay, sir.
Yes,
So your 30 seconds for your rapid fire starts now. Fuchs corneal endothelial dystrophy is mainly sporadic and rarely associated with genetic inheritance. True, false?
True.
Is incorrect. Expand SLPC.
Pass.
Pass.
Which muscle that receives innervation from the sympathetic nervous system is responsible
Muller's
for
muscle.
eyelid reflex? Is correct. What is the most common primary malignancy of the orbit in children?
Retinoblastoma.
Is incorrect. In aspired hyalosis, the vitreous particles are made of
Cholesterol.
which? Is incorrect. So we go to the answers. You got Fuchs wrong. SLKC was not answered. Muller's was correct. Retinoblastoma is an intraocular malignancy and not an orbital malignancy, which is rhabdomyosarcoma. The answer we were looking for asteroid hyalosis was calcium. So we've got 3 wrong and 1 right, which gives you a total of -5 in this round.
So the next team is team 18. That is PG. They haven't given the name to the team. So it is PG, then phone number and AIS.
That's a team from Government Hospital, Pondicherry. Yeah, are you there with us?
Yes.
Yes, sir. Yes, sir.
Okay.
All right.
Unmute yourself and be a bit louder.
Yes, sir. Sure, sir.
Okay.
So we see 1 participant only.
2, sir.
The other participant is joined through a separate device, sir.
All right.
Yes,
Okay.
sir.
All right. So, like I said, the first answer we hear will be taken as the answer that your team has given. And again, I'll remind all teams coming ahead as well as your team, in case you do not know, you can pass and come back to avoid losing negative marks for a wrong answer. All right, your time, Team 18, starts now. The crash trials that studied steroids in traumatic optic neuropathy had greater visual recovery in patients who received megadose steroids. True or false?
True, sir.
Is incorrect. Expand MEWDS. MEWDS.
Multiple evanescent white dot syndrome.
Is correct. What is the drug of choice for eyelid capillary hemangioma given systemically?
Topical propranolol.
We'll hold on to that. Hollenhorst flask is composed of what material?
Cholesterol, sir.
Is correct. We've run out of time, but you can answer this question on your screen for no points though. Injury to which segment of the optic nerve is most commonly implicated in traumatic optic neuropathy?
Intracanalicular part.
You are correct, but that doesn't get you any points. We go on to the answers.
I think
Crash
Akshay, we
trial.
can give them because we have given few 5 seconds extra for others and they had
Then
initiated.
we will give it to them. I
Yeah.
agree. Then we'll give it to you. Give it to them based on sir's recommendation. So you guys have got, so the only doubt we'll give it to you anyway. So you said topical propranolol, but the question was systemic drug. Propranolol was the word we were looking for, so we'll give it to you. You got multiple evanescent white dot syndrome right, propranolol right, cholesterol right, and intracanalicular segment right. So that's 4 right and 1 wrong, which gives you 35. Crash trial actually saw high mortality in patients who received megadose corticosteroids. So the trial had to be stopped midway. There was no visual benefit in the patients who got steroids. So 35 is the new benchmark for the rapid fire. Congratulations.
Seriously, very well played. Very well played. Good.
Thank you, sir.
So the next team is going to be IMEDS, and that's going to be from Gulbarga Institute of Medical Sciences, Kalaburgi. Yeah. IMEDS, can you unmute yourself?
Please tilt your.
Good evening, sir. Sir, we are visible.
No, tilt your camera.
Your foreheads are visible, unfortunately, not your faces.
More. Tilt it more.
Sir, are we visible?
Yes.
Correct.
Sir, myself, Dr. Harita. And Dr. Janvi, third year residents from Gulbarga Institute of Medical Sciences. Our mentor is Dr. Rajeshwari.
Good. Welcome.
Thank you, sir.
All right. Team Gulbarga, your time starts now. Streptomyces is the most common organism in canaliculitis. True or false?
False.
Is correct. Expand IRMA.
Intraretinal microvascular abnormality.
Correct. Traditionally followed eye trauma terminology system has which city's name in it?
Birmingham.
Is correct. Which global ophthalmology conference is being held in Vancouver in 2024?
Pass.
Which extraocular muscle, I've started so I'll complete, which extraocular muscle is affected by the canine tooth syndrome?
Pass.
Pass. Wisely played. We go to the answers. You got 3 correct and 2 passes, which gives you no negative scores and a grand total of 30. Streptomyces is not the most common organism. Any guesses on which is the most common organism in canaliculitis?
Staphylococcus.
All right. Actinomycetes is what we're looking for. All right. But nonetheless, you get 30. So that's a great round for you.
Thank you, sir. Thank you.
Now the last team for the rapid fire round is Team Asteroids.
Good. Sir, are we visible?
Yeah, we can see you.
Good evening, sir. This is Dr. Garima Mandui from SSMC Riva.
Dr. Atisha Mansari, SSMC Riva, third year resident. Our mentors are Dr. Pankaj Chaudhary, sir.
Lovely. So our team Asteroids, your time of 30 seconds for 5 rapid fire questions starts now. Meibomian gland carcinoma is the most common eyelid cancer in the Indian subcontinent. True, false?
True.
Is correct. Expand JOAG.
Juvenile open angle glaucoma.
Is correct. Pycroft's Garden Road in Chennai was renamed as the road bearing which name of India's ophthalmologist great?
Pass.
The effectiveness of which drug was studied in Marina trial?
Pass.
What is the most important determinant in selecting a choice of surgery for any type of ptosis?
Pass.
You have, all right. So you've answered 2 correct and passed 3. I think Dr. Prashant and I are equally disappointed that question 3 was not answered. Pycroft's Garden Road in Chennai was last month renamed as the road bearing the name of Dr. S.S. Badrinath, the founder and chairman emeritus of Shankar Netralaya. Marina trial studied ranibizumab, and the single most important determinant in selecting a choice of surgery in ptosis is levator function. So that's 20 points with no negative points to you.
Yes. So with this, we end with the rapid fire round, but teams be there. One set of MCQ is still remaining.
Madam, team 6 is waiting. Can we give her a chance?
I'll have to change the question. So can we take after this?
Okay.
Okay. After this MCQ, we will get a set for you ready. Okay. Team 6, be in a queue after the MCQ round. So the last MCQ round would be by
Sumit.
Dr. Sumit.
Yes, sir. Am I audible?
Yes, boss.
Yes.
There's some issue with the Kahoot.
Who is this? Sai, sir, team 20, I think, want to raise some query here.
Sai, is there any issue with the Kahoot?
No, doctor.
Okay. Someone voiced it right now.
All are okay with the Kahoot?
We are not able to join in. KM team. KM Ravenclaw.
Rest teams?
Other teams are there with us?
Sir, we team 6, we were not able to join, sir.
Our
Yes,
Kahoot is logged out and we have logged in by some other name.
That is different issue. Your phone number should be same.
Okay, ma'am. Okay.
We are not. I'm still not able to log in, ma'am.
Okay.
Should I quit and
Give you
start
another
again?
2-3 minutes. Please do log in. We are waiting for you.
Yeah. Thank you.
Sai, sir, can we know who is leading presently, or that is a surprise?
That has to be consolidated and it will be a surprise, doctor.
Even we have.
As such, the participants will know where they stand in Kahoot, but these marks has to be consolidated with the rapid fire round also.
Okay. Rapid fire as well as the previous performances.
Yes.
Correct.
Prashant sir, looks like whole India is joined here, right from north to south, east to west, everyone is here.
Yeah. Seriously, we are really, if you remember the first season, this season,
Yes, sir,
second and third season, we are seeing the competition and the teams from all the institutes. And all the credit goes to the quiz masters like you people who have been contributing so well to us.
All credit to you and Shilpi ma'am, sir. You are tirelessly coordinating so much. I know it's so difficult to coordinate with so many PGs, mentors, and everyone.
No, PGs are all fine. Only the quiz masters like Akshay sometimes gives me a tough time. On paper, on record.
Never an opportunity to take my case is missed.
No, Ishwar, just pulling you.
No, not at all, sir.
Being a senior, you have that, right to do that.
Yeah.
All are okay now. All are on Kahoot. Any problem? Anyone facing? KM team, you solved with your issue? KM
Sir,
team.
we're not able to join in. Just give us 1 minute. So.
Okay.
Okay. Meanwhile, we can play this rapid fire round with the team 6 icons. Okay.
Team 6, are you there with us? We'll finish off till the other people log in for the MCQ round, last MCQ round. Are you ready?
Yes.
You are not audible.
Your network is quite poor. Please do come closer to the mic and be a bit louder so that we don't miss out your answers. Okay? Are you ready? Who's going to continue?
Shalini ma'am?
Shalini ma'am? That set belongs to you. Dr. Shalini Mohan. I think Shilpi, you can take over.
Okay.
So are you there, team 5? Just introduce yourself first.
Team 5.
It is team 6, ma'am.
Oh, sorry.
Team 6. Okay. Icons.
Team 6, are you ready?
Yes, sir. Yes, sir. We are ready.
So this is the set for you. Okay?
Okay, sir.
So your time starts now. The newest anti-VEGF introduced.
Hey, pass if you don't know.
Okay, the second question is there only. Sheehan syndrome is the rare cause of dash and hypopituitarism.
Pass, sir. Next question.
Ocular Whipple's disease can be diagnosed by
Pass.
vertical movement of nystagmus drum tested by turning the drum about dash degrees.
Okay. I think we have exhausted the time.
So let's see the answers. So the newest anti-VEGF which is introduced is faricimab, that is Vabysmo. Sheehan syndrome is a rare cause of pituitary apoplexy and hypopituitarism. Ocular Whipple's disease can be diagnosed by PCR from the vitreous sample. The vertical movements by nystagmus drum is tested by turning the drum about 90 degrees. And the image which is shown is digital subtraction angiography with 3-dimensional reconstruction. Yes. So you passed all the questions. So no.
Hello, sir. First question is like a combined and given.
Your network is quite poor. We can't hear you better. Can you be a bit louder?
Hello, sir. First question is like a combined, first and second question combined and given, sir.
No, it was not combined. It was just we did it created in a last minute, but we did read out for you better.
But we in screen it's
Okay,
not
we'll
available.
we'll consider it later on. Okay, so now we are through with your rapid fire round. Let's move on to the last section, MCQ section. Or all the teams, are you there ready for the MCQ round? Your count is okay?
Yes, sir.
Yes,
Okay,
sir.
fine.
Yes, sir.
Sumit, over to you.
Yes, sir. Let's begin the questions now. Question, please. A 10-year-old male child present with the facial dog bite, antibiotic coverage should include, and the options are option A, anaerobic bacterial coverage, option B, anaerobic plus aerobic plus Pasteurella canis coverage, option C is gram positive plus Clostridium tetani, and option D is gram negative plus Pasteurella canis coverage. And your time starts now. The dog bite can lead to the life-threatening consequences, not only with the infection, but also with the virus. So the right answer is option B. It has to be a dog bite. You do consider rabies vaccine, but for the antibiotic coverage, it has to be a broad spectrum. So it will include everything, aerobic, anaerobic, and all together. Next, please. A 5-year-old boy found to have a unilateral telangiectatic retinal vessels with exudative retinal detachment. See carefully, a male child with unilateral retinal detachment. What histological finding is characteristic of the likely diagnosis? And the options are foamy histiocytes and the cholesterol crystals. Option B, loss of capillary pericytes and thickening of the basement membrane of retinal capillary. Option C is dilated thin-walled vascular channels between RPE and the outer aspect of the Brooks membrane. And option D is focal sclerosis of the retinal vessels with overlying pocket of the liquefied vitreous. And your time starts now. I suppose by now everyone has got the diagnosis. Time is up. The diagnosis is a Coats disease, and the correct answer is foamy histiocytes and the cholesterol crystals. Telangiectasia was pointing out towards your diagnosis, and I will not go into the explanation, but the exudative retinal detachment is what happens because of this histiocytes and the crystals in the subretinal space in the Coats disease. Next question, please. What is a known risk factor for degenerative retinoschisis? And your options are prior retinal detachment, option B, hyperopia, which is hypermetropia, option C, lattice degeneration, and option D, it's collagen vascular disease. And your time starts now. This is degenerative retinoschisis. And your time is up. And the correct answer is hyperopia. So this is not a myopia which will have a lattice and the risk of retinal detachment, but somehow the degenerative retinoschisis is more commonly associated with the hyperopia. Next question, please. How is uveoscleral outflow affected by the pressure, age, and cycloplegia? Pressure, age, and cycloplegia. And the options are it's pressure sensitive, decreases with the age, and decreases with the cycloplegic agent. So both decrease. Option B, it is insensitive to pressure, decreases with the age, but increases with the cycloplegic agents. Option C, it's pressure sensitive, increases with the age and decrease with the cycloplegic agents. Ulta of B. And option D, it's pressure insensitive, increase with both age and the cycloplegic agents. And your time starts now. All of you know uveoscleral outflow is very important channel of drainage rather than other than trabecular mesh work. And your prostaglandin analogs work on the same. So the answer is it's pressure insensitive. Let it be a 50 or 10. It is going to work in a similar manner. It will decrease with the age because of the change in the uveoscleral meshwork completely. And it increases with the cycloplegic agents and of course with the prostaglandins. And the opposite effect is with the myotics. So coming to the question number 5, last in this series. An ophthalmologist is surgically exploring a blunt globe injury secondary to the racquetball trauma. So it's a blunt injury. Patient presents with the 360-degree hemorrhagic chemosis and intraocular pressure is 3. So there is hypotony. Intraoperatively, surgeon has done 360-degree peritomy, but no globe rupture is identified. Imagine you are on the table and this is what happening. What is the next appropriate step? The options are close the peritomy and leave the patient, pad him. Exploration under the recti muscle. Option C, pars plana vitrectomy. And option D, is placement of a scleral buckle. And your time starts now. This is very common in your residency where you will repair most of your globe rupture. May not ever see post residency all these cases. And the correct answer here is option B, exploration under the recti muscle, because there is definite hypotony. There has to be a scleral tear and the globe rupture, and most commonly the missed scleral tears are found to be below your under your muscle. So exploration of the muscle is very important when you're looking at such a hypotonic blunt injury. I hope everyone got that correct. That finishes my round.
Great. Thank you, Sumit, for wonderfully summing the last set of MCQ. I hope the postgraduates enjoyed it and it was not that tough. I know our quiz masters are all very professional and seasoned, and they were quite kind enough. Before I make any comment, can we have other people also with us? All the quiz masters, can you join us? I request all the quiz masters to be
Yes,
with
sir.
us as
Yes,
well
sir.
as.
Yes, sir. Very much yes.
Do we have any of the mentors with us today? We can have a small chat with them. I think Dr. Rajesh. Are we missing? Okay, the teams who are with us can join in till we. Dr. Nibha. Dr. Nibha Pasi is the mentor for team the Eagles from Rohtak. Can we have you with us? Okay. Dr. Rajeshwari. She also happens to be the mentor. She's following her team. We would like to have a small chat. She's a mentor for team IMETS from Kalaburgi.
So, sir, meanwhile, the mentors are joining. I would like to ask anyone third year here from Asteroids or Warriors or KM or the Eagles. Asteroids, can you switch on your video, please?
Yeah. Please do join in. Come on. We'll have a small chat before we wind up. Akshay, you can also join in.
The Eagles, are you third year? Are you exam going students?
Yes, sir.
So we just wanted to know from Brain Teasers that is this quiz helping you or is it changing your perspective while you read the book? Was it different before and now it is different, and how it is different?
Hello?
Yeah,
Yes,
go
tell
ahead.
me.
Go ahead.
Waiting for your answer.
Hello?
Yeah, we can hear you. Go ahead.
Sir, can you repeat your question, please?
So we asked that now after attending the quiz and participating into it, has your way of reading the books and reading the article changed? Has it changed your perspective while you study for your exams and otherwise you read your books after attending the quiz?
It has changed quite a lot, sir. Earlier, it was just a 1 week kind of a study. Now we go back, look into the topic. What are the more important things to look for, and how to study has definitely changed for a better something. Yeah.
So especially the updates you tell during the quiz sessions, we get more aware about the updates which are happening to read the journals, upcoming journals and all.
This team belongs to the college. Last year, this team belongs to the college Rohtak PGIMS. Last year, they were the finalists and they were the winners. Yes. So they have a lot of responsibility, probably carrying the burden of that last year's performance from your seniors.
So that's what we want legacy to be followed, and this quiz are basically made in such a way like Prashant sir, Shilpi ma'am come up with this one-liners, so which you can ask in your rounds during your otherwise informal meetings, so that it grows a knowledge and it gives a different kind of competition among all of you. So your juniors, we would like to see next year participating with the same enthusiasm as well.
Yes, sir. So we have a query. Actually, our got disconnected. Our Kahoot got disconnected, and we reconnected it. Phone number is same, but the name is different.
That we are tackling.
That
Don't
will be
worry.
taken care.
We are taking care of that. Okay. So
Thank you
best
so
of
much.
tell Dr. Nibha we missed her for a chat. We would have loved to have her with us today, chat. But let us catch up later.
Thank
So
you,
I
sir.
think- okay. And we also have Dr. Any other team? Come on the screen. I think the guys have I think the quiz masters have really exhausted my postgraduates over there, all the teams. They're running away. So I think we had a good session 2, that is quarterfinals 2. We had a very nice session. Dr. Shalini, Dr. Akshay, Dr. Sumit, you have done a wonderful job for getting all those interesting questions. And seriously, they were challenging even my cortex, which whatever that redundant amount is left over now with me. So be it. It was a great show from all of you. I'm really thankful from team, me and Dr. Shilpi, both of us are thankful to you for your contribution. And we are sorry if we pestered you a lot. Remember, postgraduates, our third quarter final will be 2 weeks later. That is on 10th of April, again at the same time, 8 o'clock. We will have a next set of quarter finalists. Remember, all of the people who have played in quarterfinal 1 and 2 also can play there as an audience, so that they become eligible for whatever that particular episode prizes are there. And they can also at the same time learn from those episodes, because one of you are definitely going to be into the semifinals. Few of you rather, I should say. So be on a watch out. Do follow the quiz for the session quarterfinal 3 as well as quarterfinal 4. And at the conclusion of quarterfinal 4, we will be declaring who are the people who have made it into the 2 semi-finals, which will be done later, subsequently after that. So till then, it's time for us to say bye-bye. Once more, my sincere thanks to Microvision team as well as Numeratic team for being with us and contributing to it. Thank you till then. Bye-bye.
Bye, sir. Thank you. Thank you,
Bye.
everyone. Thank you, sir. Thank you, Microvision.
Bye.
Bye, sir. Leave it.